I'm joined on Beyond the Headline by Dr. A.S. Anoop Kumar, Director Critical Care, Aster, in North Kerala Cluster. Dr. Anoop, good evening. Thank you very much for speaking with Mirror Now. You're somebody who has been instrumental in identifying the Nipah virus, not just this time around, but back in 2018 as well, when it first entered India and the outbreak was seen in Kerala. First of all, help us understand how did you detect the Nipah virus? What did you see in the patients? And when was it identified in Kerala?
In 2018 outbreak, we identified the Nipah for the first time. That time we had a cluster of patients coming from a same family with encephalitic symptoms. But they were having some unusual symptoms than the normal encephalitis we usually encounter in the ICUs or in the emergency department. And in that family, there was a death which occurred almost 2 weeks before, and he was also having unusual symptoms. So, like an index case, then a clustering happening, then the unusual symptoms. These made us to think about some unknown viruses. Then on detailed history, like they were having like contact with they were like staying near a forest where there were many bats. So that made us made us to think about the possibility of Nipah, and the samples were sent, and we were able to identify for the first time. But this time the situation was entirely different. But again, there were a few similarities. Like one patient was dying in another hospital in Calicut with bronchopneumonia, then later on going into multi-organ failure. But after almost 10 days, so the first patient died on 30th of last month, but on 10th of this month, to the hospital where I am working, four patients admitted from the same family, three children and one adult with fever and cough. So they were mainly having respiratory symptoms alone. So they were having mainly the respiratory symptoms alone. And again, in those group of patients as well, there was a few unusual symptoms. Like the first patient had the slurring of speech, diplopia, etc. And the present patient who were admitted, like one of those patients, developed a seizure along with the features of bronchopneumonia. And these patients were coming from the same epicenter where the initial cases were reported in 2018. So again, an index patient, clustering in the same family, some like doubtful symptoms, and the location wise from the near epicenter. That made us to think about the possibility of Nipah. We have informed the health authorities immediately and sent the samples after the initial screening from our hospital itself. So again, within a very short time span, we were able to identify and able to isolate the patients. And as we have informed the health department and the state government, they were also very active in all the preventive measures. The health minister immediately reached the city here in Calicut and arranged all the preventive measures like the contact tracing, and all other the measures to prevent this outbreak.
Okay, Dr. Anoop Kumar, what's the situation like currently in Kerala? Should we be worried that it might turn into a pandemic-like situation, the kind that we saw during COVID-19, or is it going to be different? Has it been contained at a very critical stage?
It is very unlikely to happen a pandemic with Nipah, because we have the history of many previous outbreaks. There were almost 650 cases reported before from 1998 to 2023. So in all those small outbreaks in different countries, the outbreaks will usually settle by its own. The usual nature of Nipah virus is when the transmission occurs from one person to the other, the transmission chances are coming down, and again it will not spread from the second person to third person, and it will not multiply like that, or the transmission rates will come down as the disease getting transmitted from one person to the other. So it is very unlikely to make a pandemic, and usually these outbreaks will get self-contained. That is what we have experienced in last three outbreaks in Kerala and other experience from other areas as well. So we don't have to worry about any pandemic. And right now also in Kerala, the situation are fully under control. We have all identified all the contacts of the patients like from whom we have diagnosed the Nipah, and all those the identified contacts are quarantined and they are all under close monitoring whether they are developing symptoms. And we have made all arrangements to test for the Nipah when they are developing early symptoms and to provide the best treatment possible.
Okay, Dr. Kumar, you said that cluster infections is what alerted you. A family had been, infected with the Nipah virus, and there was the father and the two children. So clearly that means that this is not restricted to any age group. It can infect anybody, and everybody is vulnerable when it comes to the Nipah virus. Does it also mean that the symptoms are also going to be same in all age groups, or it's going to be more in vulnerable groups such as children and the elderly and the ones with comorbidities, or is it going to be similar for all ages?
Yeah, with our previous experience and again the previous data, the symptoms will be almost similar in all the age groups, and all the age groups are prone to develop symptoms also. And we don't have enough data to say that the vulnerable people, when they are getting infected, like in case of COVID, they are having the mortality chances in them are high. We don't have any evidence right now to say like that.
Okay, my last question to you, Dr. Kumar. We've seen Kerala being at, an unfortunate point where it does get a lot of these new viruses that come in. We saw that with coronavirus. We are also now seeing it with the Nipah virus. What makes Kerala so vulnerable as a region, geographically or otherwise? You might be knowing better. That we see the cases, some of the initial cases in Kerala first?
No, I don't think that statement is correct, and I don't think the Kerala is more vulnerable. It is because our health system is so much advanced,
Okay.
where we can suspect and identify the cases so quickly. So that has happened in COVID time also. We were able to identify from the first case itself, the previous Nipah outbreaks, the Zika virus, and again the Kesanur forest disease. All those viral outbreaks were picked up from the initial cases itself. So that is why more viral cases are getting reported. This time also, like as I've already told, a person was coming with the features of pneumonia, and a few of the contacts were developing pneumonia again. So even with such a unusual presentation of Nipah, we were able to identify from the second group of patients itself. In 2018 outbreak, also the same thing was happening. Before that, everywhere, even in the Singapore, the country which is having an excellent healthcare system, even they were not able to identify the outbreak in few weeks or even months. So after the many persons died, then only they were able to identify that was a Nipah outbreak. But in Kerala, like all the time, this is the fourth time we are getting the Nipah outbreaks. So every time we were able to pick it up from the first case or from the second case itself. So that is why we are getting more viral outbreaks in Kerala. It is not because the incidences are more. It is because we have an excellent healthcare system where we can identify and isolate these cases very effectively.
All right, all right. Thank you very much, Dr. A.S. Anoop Kumar, for talking with Mirror Now. Of course, all of you in Kerala, please do take care of yourselves as this new health concern does come up. But thank you very much, Dr. Kumar, for joining us on Mirror Now and helping us understand how this Nipah virus really is developing in the state of Kerala.